Hello everybody, Dr. David here
Dr. Ian.
from Sporadic Health Chiropractic in the Hunter Valley practice. So today we would love to discuss to you how to filter-proof your spine from degeneration, aka wear and tear. So degenerative disc disease in our spine, generally people feel a bit more stiff as they grow old. We lost a bit of range of motion, and oftentimes people can experience a bit of weakness, a bit of pain, back pain, as well as weakness in the limbs, as well as numbness going down their hands, as well as their legs as well. So in our geriatric populations, when we get a bit older, individuals diagnosed with degenerative disc disease rate is a lot higher compared to younger generation, and it often comes with diagnosis like radiculopathy. That means some symptoms that you can experience in your limbs that are coming from your spinal cord, myelopathy, some sort of weakness. What else do we have? Spinal stenosis, spondylolisthesis, which is a bit of low-grade chronic inflammatory conditions. So there are some cool research in regards to degenerative disc disease, especially in that younger populations. For example, one research indicated 90% of professional soccer players have at least one level in the spine that is indicated they started to have a bit of degeneration, as well as Olympians, while they do their MRI after their competition, was found that they have higher rate of degeneration around their neck as well as their lower back. So what can we do to prevent this, Ian?
Yeah, there is hope, so it's not all just doom and gloom as you age. But let's talk briefly a little bit about disc. So the disc is in between the vertebrae. It's a little bit like, you can think about it like a tire, or you can also think about it if you have come across a jello, that burst, that has a liquid burst in the middle of it. So it's like soft and spongy, but it's got some solidity to it, and in the middle of it there is liquid. So it absorbs impact, right? So it's like a cushion. And that all well and good if things are well aligned, if things are moving accordingly between each other in each segment. But as we've discussed, especially if you're moving it or using it a lot, some segment may be stuck, or the other segment may be loose. So we're just gonna be able to create that balance, and that's one way of helping. So manual therapies like chiropractic obviously can help in ensuring that each segment is moving optimally, so that way the loading will be as even as possible as we continue on with activities. Various manual therapies that can also then create some kind of distraction force, just to help alleviate some of the compressive force of it, especially if we're standing around all day or without work and doing sports, just like impact. And other things that we can do is this, as this thing is like liquid as well, we need to look after our body as a whole. So obviously drinking water, but then things like having some vitamin C, which helps in the synthesis, the build-up of the collagen, which is what it's
I think that's really important.
And collagen supplements.
To look into the collagen component in the disc as well, because the outside fibers, the really tough material there, it's largely made up of a type of collagen, and we can get this collagen from, for example, bone broth, some chicken, fish and egg whites, as well as vitamin C that Dr. Ian actually mentioned, that helps build up and synthesize this collagen. So it will help rebuild the health and maintain the health of the disc, as well as something that we would like to avoid in general, for example, smoking, alcohol, inactivity, and things like that. So if you would like to know more, is there anything that you'd like to add on?
No, it's pretty good.
Okay, so if you'd like to learn more, don't forget to read our previous blogs, and they're up on our website. See you guys.
See ya.